We're going to teach you about the Stimulability Approach by Ethan Gurman, Laura Jones, and Matt Stevens, student clinicians at Rocky Mountain University of Health Professions in the Masters of Science in Speech Pathology program.
Adele Machio and Mary Elbert authored the Stimulability Approach in 1996. Stimulability refers to the difference between a child's actual level of performance and his or her potential level of performance within a highly supportive context. In other words, stimulability tests a child's performance to imitate a correct adult production of speech sounds in isolation or within syllables and words, which includes auditory and/or visual cues. In 1996, Machio and Elbert proposed that teaching stimulability may be a way to increase a child's phonetic repertoire, which will increase the number of possible contrasts that can be produced, therefore increasing intelligibility. Data from stimulability testing is used when creating treatment plans in regards to the speech sounds needing to be targeted.
Some of the goals of the Stimulability Approach. The first one encourages stimulation and retention of non-stimulable phonemes by targeting a phoneme by associating it with alliterative character cards paired with a hand or body motion. Motions must never replace speech and always be paired with speech sounds.
Laura, let's have some fun. These cards have silly words and pictures on them. I want you to copy what I do and say. Can you tell me what we're going to do?
I copy you.
Excellent. So let's start with the first picture. I want you to listen and watch. Baby bear.
Baby bear.
Good try. That was really close. Let's try again. Baby bear.
Baby bear.
That was perfect. Excellent, Laura. Let's try another card. Dirty dog.
Dirty dog.
Perfect. That was a great job.
Thanks.
The previous drill play activity was an example of the child not reaching the non-stimulable target. The clinician modeled again and gave the child another chance. Now, we will show you an example of a play activity that uses joint attention.
Laura, you just chose fussy fish.
Fussy fish.
Super job. Now let's try to match that card. Laura, the next card you chose was Happy Hippo.
Happy hippo.
You're doing a great job, Laura. I'm really proud of you. Let's go ahead and flip those cards over and try to match two more.
Thanks.
Some of the theories behind Stimulability Approach are based on and supported by intervention studies which suggest that perception and stimulability represent independent abilities. One theory reflects a level of underlying phonological knowledge. The second theory is the study of how phonological knowledge and stimulability relate to each other, and it found that stimulability was not associated with speech perception ability. The main point is that correct underlying representation was not required for stimulability. And third, the last theory suggests that dynamic assessment and stimulability are connected. Dynamic assessment uses Vygotsky's cognitive model of development, which explains that there is an actual level of development and a potential level of development. The level between the two is called the zone of proximal development. Whether a child is stimulable for a sound depends on that zone of proximal development. The zone is the level between the child's actual performance and the child's potential performance, and it uses a high amount of support from the clinician. Some of the types of ideal clients for this intervention are kids between the ages of 2 to 4, and many of the issues they have are distinct consonants and they have small phonemic inventories. They should have typical oral motor skills and cognition. Other candidates for therapy can be clients with acquired apraxia of speech, children with apraxia of speech, children with speech sound disorders due to hearing loss, children with a cleft palate, and children with Down syndrome. The time frame of therapy is between 4 and 12 weeks, once or twice a week for 30 to 45 minutes. It is important to remember the broad approach should be applied. All target sounds will be incorporated in every session. The key components of the stimulability approach: 1. Directly target non-stimulable sounds. 2. Make targets the joint focus of attention. 3. Associate speech sounds with hand and body motions. 4. Associate speech sounds with alliterative characters. Encourage vocal practice. 6. Ensure early success. And 7. Ensure successful communicative attempts.